Hi everyone, so welcome to my Learning Mind Crew channel. Um, I'm so happy to introduce the second video of my lecture series on bowel assessment. So everybody is well aware that they have added new sets of skills for the October 17th cohort, and I'm telling again, so from October 17th onwards, NMC has officially announced that the new skills will go live and students will be assessed and will be expected to know and perform the new skills. So I'm just going to put only the videos of the new skills because the resource material is still not out there. So only thing we got is the marking criteria, and we are going to make use of whatever we have. And I've just created some teaching slides so that will be easy for the new learners to understand what the skill is about. So let's go into the bowel assessment in this video. So before I proceed, please subscribe to my channel. Please press the bell notification icon. Then only you can able to get the other videos on that day itself. So you will be notified if I post any video, any new videos. And I'm telling again, I'm going to post at least a minimum of 2 videos every day, so that because we have only 3 weeks time before October 17th, and we need to make use of as much of whatever we got in this limited time. So please subscribe and please press the bell notification, and let's go into this today's video on bowel assessment. So this is a very what to say, so it is a very interesting skill actually. So we don't have much information about the skill. So whatever marking criteria we got, I've just put it in the slide. So it may be a silent station because from the looks of it, so it looks like they've clearly mentioned in the second and the third point, handwriting is clear and legible. Ensure that strike through errors retain legibility. So these are the points I have seen somewhere else in the marking criteria in some other skills as well. So in the planning they've mentioned it, so I'm assuming that it may be a silent station. Okay, so I'm just assuming it, so nobody knows what it's going to be, but it's good to prepare before it comes out. So according to the marking criteria, you may need to fill a Bristol stool chart by looking at a photo. Why I am saying that? Because on the fourth point they have mentioned if using photo A or B, so you are supposed to correctly recognize the stool type. So from the words they have given, I am understanding they may give you a photo, and the photos can be a photo A, which indicates a type 1 stool, or a photo B, which indicates a type 2 stool, and photo C, which indicates a type 6, or a photo D, which indicates a type 7 stool. So there will be 4 different types of photos, and you need to look at the picture and you need to recognize the type of stool, and you need to complete the Bristol stool chart, and you need to sign, you need to put your date and the time wherever it is expected. And after you identifying the stool chart, you may need to write the plan of care for the different type of stool. For example, if you have a type 1 stool, what type of, so type 1 and type 2 is definitely constipation, so what type of care you will write, so that they may expect, and they're expecting minimum 5 aspects of care. Okay, so you just need to remember the plan of care, and I will go through in a minute. So this is a Bristol stool chart. I got it from the internet. It is readily available. You can Google it. So if you look at it, there are 7 different types of stool. Type 1, separate hard lumps like nuts. Type 2, sausage like but lumpy. So type 1 and type 2 considered as something abnormal, and it's constipated stool. Type 3 is like a sausage but with cracks in its surface. You can see it in the picture, it's all clearly given in a pictorial representation. Type 4 is like a sausage or snake, smooth and soft. Type 5, soft blobs with clear cut edges. Type 6, fluffy pieces with ragged edges, a mushy stool. and type 7 is watery, no solid pieces. So according to the marking criteria, they are expecting you to identify type 1, type 2, type 6 and type 7. I think from their point of view, they consider type 3, 4 and 5 are all normal. Okay, so even this picture is saying type 3, 4 are considered normal. So according to the marking criteria, they're not testing type 3, 4 and 5. From the looks of it, it looks like they expect you to identify type 1, type 2, type 6 and type 4. There will be 4 different pictures. So if you are given type 1 or type 2 type of stool picture, so you need to give a plan of care. So I've just listed down as a key points. Okay, it will be easy for you to remember if you just remember these keywords. If there is constipation, first thing you need to do is explore the possible cause of constipation. So maybe you can mention it like, I will consider the possible cause of constipation, like whether it is caused by some medication, because certain medications can cause constipation, like codeine can cause constipation, and explore potential other alternatives, like what else could have caused this constipation. So I will explore it. That will be your first plan of care. Okay, the second will be giving dietary advice. So I will give dietary advice about eating high fiber rich diet, like eating more fruits and vegetables. And the third point is I will propose obtaining a prescription. So I will make sure that patient is getting a prescription for laxatives. And the fourth point is I will encourage them to increase their fluid intake. Sometimes if there is dehydration and if they are not drinking enough water, that also can leads to constipation. And fifth one is encourage them to physically mobilize. So physical movement or mobilization is very, very important, especially in a hospitalized patient, because they will go into deconditioning when they don't move, and there will be less bowel motility, and physical movement always helps. So that is the fifth advice you will write as a care plan. And the sixth point you will talk about is, if there is an urge to defecate, I will advise not the patient to ignore. So they should not ignore the urge of defecating. That will be a sixth point of advice you will give to the patient. And the seventh point is you need to acknowledge that there is a need for you to come back to the patient and to reassess the bowels. To reassess the bowel means you can again come and check the type of stool they are passing, or you will come again and check with the patient the reason again why they are not passing, or whether they are passing now, or whether they have improved, whether they have followed your suggestion. That is the need to reassess the bowel. And finally, positive toilet habits. The positive toilet habits are like providing enough privacy, providing good positioning. When we talk about privacy, especially in a hospital setup, there will be a lot of, if you're providing a bedpan, patient will not be comfortable using a bedpan because they are used to have a good privacy at their own home, and in the hospital they may not use the bedpan just because they don't have the privacy. So that is one important point. And other positive toilet habits are like giving good positioning to the patients. So if they can't able to do it in the commode, maybe try other alternative options, like how they can mobilize to the toilet. We can able to get help from the physiotherapists, and maybe we can assess their mobility, use enough walking aids and supports. We can take them to the toilet, and we can give good positioning while they defecate, and encourage them to do deep breathing exercises, and encouraging them to spend enough time going to the toilet rather than rushing the patient into the toilet. So these are the positive toilet habits we can advise them on. So I've just broken down, these are all given as statements in marking criteria. I've just broken down into key points. So just remember just the key points you will be writing. They're expecting minimum 5 aspects of this care. I think it has 8 points have listed down. In this 8, they are expecting at least 5 in order to get full mark. And if you write only 3 aspects, you will get only partial mark. So but we are all aiming for full marks. So it's very easy to remember. Just remember these key points and put it in your own words. So do not write like as if you are writing it, memorizing it and writing it as a script. Understand and apply. Okay, so this is the care plan for type 1 and type 2. So let's move on to the next care plan. They've given for type 6 and type 7. So they may show a photo C or a D, which may indicate a stool of type 6 or a type 7. So you need to recognize the stool, you need to mark it in the Bristol stool chart, and also you need to propose a plan of care to prevent or reduce the diarrhea. So there are 8 steps again, which you may write. In that again you may have to write minimum of 5 aspects of care to get a full mark, and if you write 3 aspects you will get only partial marks. So let's go in detail about each keywords I have listed down. So they're all huge sentences I've broken down into key points. Just remember these key points and understand what it mean by. Okay, first consider possible cause. So if you remember in care plan for type 1 or type 2 also we already started with considering the possible cause of constipation. Same way we are going to consider the possible cause of diarrhea. Okay, when you look at the possible cause, it can be various reasons. It can be food poisoning, it can be a overflow stool, it can be any medications. Most of the antibiotics can cause diarrhea. It can be a healthcare acquired infection, or it is a community acquired infection. Okay, when you talk about healthcare acquired infection, it can be a norovirus or a Clostridium difficile or a CPE, or it's simply a malabsorption. So just you need to write it down that I will consider exploring the possible causes of diarrhea and mention all these various causes. You need to mention it in the plan of care. And the second point is consider infection prevention control measure. IPC is infection prevention control. So what all the infection prevention control you can take if a patient has diarrhea, that you need to list it down. That I will try to isolate my patient in a side room, I'll send sample for culture, okay, and I will seek the infection control team's advice regarding any other isolation precautions I may have to take when the patient is in the hospital in order to prevent the spread of the infection to other people. So that is the second important point. And the third is offering dietary advising. So you remember in the care plan, the previous care plan, we already mentioned this point, dietary advice. There you will encourage them to eat more fruits and vegetables. Here you will encourage them to reduce their fruit and vegetable intake. They may have to reduce their high fiber intake, because high fiber is not good for diarrhea. It can again cause more motility in the bowels. And the fourth point is there you are proposing for laxative, here you are proposing for anti-motility medication. Anti-motility medication will stop or control the bowel movements, and there you are considering dehydration and you are increasing the fluid intake. Same way here also, you definitely patient will go into dehydration because of diarrhea, and you need to encourage them to drink enough fluid while they are having the diarrhea. So they need to replace the lost fluid somehow. They need to increase their fluid intake. And finally, check perianal skin integrity. It's very important because especially frailty patients, elderly patients, they are very easy, they are more prone to have bed sores and dermatitis, especially moisture associated dermatitis when they are having diarrhea. So when they have continuous type 7 loose stool, and when nurses keep cleaning them, there is a chance that the skin gets broken down. I can explain to you what is the reason behind it. So the stool has a more acidic pH, and it can when the stool comes in constant contact with the skin, already their skin is very fragile, and it has not much skin turgor, and this pH, the acidic pH, can break down the protein bundles of the skin and slowly develops into a moisture associated dermatitis. That's why it's very important to check perianal skin integrity if the patient especially have diarrhea. And promote positive toilet habit is important again. Here same thing, you're going to advise, you're going to encourage having more privacy, because patient will have multiple times, patient may have to go to the toilet, so privacy is very important. Positioning, again, it will help the patient to feel better, and positioning always helps them. And close proximity to toilet is very important, or provide a commode if the patient can't mobilize well, because as I said earlier, in the diarrhea condition, patient may have multiple times loose stool throughout the day, so it is very important they should not get tired because of incontinence, because of urgency to defecate. If they are a frail patient, they can slip and fall when they have the urge, and if they are rushing to the toilet. That's why it's very important to keep the patient near the toilet, or keep the commode near to the patient bedside, and give enough time for the patient to use the toilet. These are the positive toilet habits. There are 4 positive toilet habits: privacy, positioning, close proximity, and spending time in the toilet. Okay, just remember like that. Then again, you have a need to reassess the bowels. So this point is also repeating from care plan for type 1, type 2. So here also you need to reassess the bowels. So it's very simple. It's what we are already practicing in this country. So just I've explained it in detail. Remember only these key points and understand it, and try to apply it and use your own words when you are writing the plan of care. Remember, they don't expect you to memorize the marking criteria, and it should not look like it is scripted. So what they want is, they want you to understand the possible consequence and your proposed care plan for such scenarios and eventualities, and they want you to apply your nursing knowledge and skill in that eventuality. So please understand, this is what we expect and this is what we do for our patients, and use these keywords, and based on these keywords you need to create your own care plan. When they read the answer, the key words or the crux of the matter should not change, but rephrase it. Okay, I'm sure that's the end of this video, because this skill is all about identification and proposing action. Okay, 2 steps: you're identifying the stool and mentioning what type of stool, and proposing a care plan, and you're going to write it down in a piece of paper, and most probably it will be a silent station, I'm assuming. So let's see, when the resource material comes out from the NMC website, we will go into more detail about the skill. And you also please post your comments or queries or suggestions, or your any information you have got. Please put it in the comment section so that everybody can read, and everybody can they can share their views, and we can enrich each other regarding the skill. We have only very limited time. Please subscribe and press the bell notification if you want to get the other videos as well. Thank you so much, and have a nice day.